An important area to target for postural correction as well as injury prevention in the shoulder girdle and the shoulder complex is external rotation or rotator cuff training. So external rotation means rotating the upper arm bone in the shoulder joint away from the body, so away from the midline of the body. That's done in a tricky manner. It's really a tough coordination to simply isolate external rotation. That would be me pushing those thumbs back. Internal rotation comes in. External rotation, again, rotator cuff is an upper back area of the body. You have 4 or 5 different muscles that assist and facilitate external rotation up here. Your primary movers are all small little muscles, 4 muscles in that shoulder blade. They wrap around that outer side of the humerus, your upper arm bone. So when they shorten up here in the back of the shoulder, they're pulling their tendons around here for this small, tiny little range of motion exercise. But it's super important, again, to help combat round shoulder syndrome. External rotation helps keep that upper arm bone and ball and socket in position. But they're very important stabilizers when we're pushing and pulling, especially in more riskier situations. So rotator cuff tears become really common just doing simple things like pulling on a hose or pushing something up to the ceiling. So external rotation from a resisted standpoint, we can use bilateral or unilateral exercises. We'll cover more modes and variations of that in later videos. But I'm going to start you real simple with the arms to the sides and using a mini band. You could also grab a bigger band and just grip that, or a super band or a TheraBand from the physical therapy, and just grip onto it, though gripping through the forearms makes it a little bit harder. However, you could also use different thumb positions to challenge this. So I'm going to grab it palms up. I'm going to grab as close as I can, knowing that I want to get a good resistance and range of motion. I'm going to probably just grab one of those. I'm going to set up from the lateral view in basically standing postural position with about a 90-degree bend in my elbow. From the front position, you'll see the motion is very minimal, rotating those hands away from the midline and then back to the midline. Away and back to. And it takes some time, it takes some repetitions to really feel this because it's not a very big movement. It's actually a pretty small movement. As I turn around back here, you may see the most minimal little crinkling of my shirt as I go through here. The target area is going to be more through this back of the shoulder here than between the shoulder blades, though you do get a little bit of motion between those shoulder blades. So this is a very small beginning phase of the range of motion for external rotation and rotator cuff training. You do 20 of these puppies and you're going to find those back side of your shoulders and wear them down. Now there's other variations we could do. If you have good shoulder health and don't have any issues flaring your shoulders to the sky, you could also do external rotation from the flared position. This one's much more risky on those shoulder joints, but it's also a lot more complex, having to coordinate your stabilizers to keep this upper arm bone horizontal to the floor and just do pure rotation. We don't want a bunch of elbow wiggling around. What's most common is that the elbow would drop and you're not using rotation, you're not using the leverage to strengthen those rotator cuff. So those are 2 different variations, training your rotator cuff muscles and helping to restore good back posture, upper back strength, and to prevent shoulder injuries throughout later years of your life.